to welcome you all to Mass General and to this historic ether dome. And I think it is extraordinarily fitting that we are hosting the launch of the Health Information Exchange System from this historic room today. And that is because it was exactly 166 years ago, on October 16, 1846, when another important public demonstration occurred at this very site, actually where those cameraman is seeing. That was where the first demonstration of ether was used as an anesthetic in surgery. Prior to that time, patients were held down to undergo their surgical procedures. It was an extremely painful undertaking. The reason the doors on this room are so heavy was to prevent the screaming from scaring away other patients. But all that changed on October 16, 1846, when a Boston dentist named William Morton came to the MGH to demonstrate the use of the technique that he claimed could eliminate the agony of surgery. Morton brought forth an unusual-looking glass inhaler and administered special vapors to a patient named Gilbert Abbott, who was suffering from a large tumor in his jaw. And when Mr. Abbott was unconscious, the surgeon, Dr. John Collins Warren, who was the chief of surgery, removed the tumor, and when the patient awoke, he reported that he had experienced no pain during the operation. And Warren, who was quite a skeptic about this ether, was quoted as saying at the time, "Gentlemen, this is no humbug." And Dr. Henry Bigelow, who was present at the demonstration that day, remarked that he had seen something that will go around the world. And indeed, one of the most noteworthy aspects of what happened here in 1846 was the speed at which word of this traveled around the world and changed the practice of surgery, changed the history of hospitals, not only in this country, but around the world. Within a month, ether was being used in surgeries in Philadelphia and New York, and news traveled across the Atlantic by ship, and by December of 1846, physicians in London were also using ether. An item in the People's Journal in London reflected the excitement, and I quote, "Oh, what delight for every feeling heart to find the new year ushered in with the announcement of this noble discovery of the power to still the sense of pain and veil the eye and memory from all the horrors of an operation. We have conquered pain." So this historic room today embodies the idea that sharing vital medical information can make a huge difference in improving the experience of patients, improving the quality of care, and also reducing its costs. And we are delighted that this ether dome is the backdrop for this wonderful event in the history of healthcare in this Commonwealth. And it's certainly our belief that sharing of electronic medical information can remove and eliminate some of the pain that patients feel today when doctors or other providers that they're seeing in one institution may not have access to the medical information from another.
All of the partners who have helped us come to today, thank you for being a part of this. To Senator Moore and Chairman Walsh, thank you for the extraordinary leadership you have shown in healthcare access and cost containment partnership. The great partners you have been. To Dr. Slavin, thank you for your leadership of this hospital and in the industry generally here, and your friendship over many years. And I want to acknowledge Dr. Harry Rudash, who's my surgeon, and uniquely understands why I was squirming so when Dr. Slavin was describing what happened the year before. He's a brilliant surgeon, and when he stands, you'll understand why the first thing I said to him is, "Doctor, you're too big to operate on me." I want to thank and also give special acknowledgement to CEO Mark Toloski from Baystate Health in Springfield, from whom we heard just a moment ago. I do want to be clear, I am very confident and very at ease in sending my medical records across to Baystate, but I want everyone to understand, I'm not broadcasting this to everybody. You have to be on the receiving end and an intended recipient to get anybody's documents. And maybe it is worth making the point, reminding people that this is a highly secure network. People should have confidence in this network. And the reason we've developed this network has everything to do about an equation that many of you in the industry appreciated a long time before. But we in policy-making positions have joined with you to help deliver. And that is that we can have better quality care and lower cost care at the same time. So the notion of reducing errors of assuring that the very best care is delivered in the very best way at the right time is very much what using this technology is about. The technology is not an end in and of itself. It's a tool. And it is about better care at lower cost. The health information exchange will enable a secure and unrestricted exchange of health information among diverse organizations, like doctors' offices, hospitals, laboratories, pharmacies, skilled nursing facilities, and health plans. Today's golden spike launch of the health information exchange represents a milestone in the meaningful transformation of how healthcare is paid for and delivered, and that is a very exciting thing. In addition to all of you who have toiled on the details and the broader vision alike in getting us here today, I also want to thank the Obama administration. Through stimulus funding and support from the senators of Medicare, for Medicare and Medicaid, Massachusetts is the first state in the nation to leverage significant federal Medicaid funding to help build the statewide health information exchange. That is no small accomplishment. Give yourselves a hand. We are cracking the code on healthcare costs to further advance a world-class healthcare system for all residents. In order to truly accomplish this, we rely on public-private partnerships, and I just want to underscore the Secretary's comments here. This is not about government alone. It's not about an individual company alone. It's not about an individual health plan. It is about all of us coming together, sharing ideas, building together, and delivering a solution which is about all of our residents. And why do we do that? We do it for the same reasons we embarked on this journey of universal care, for the same reasons that we came together in August to launch the next phase of healthcare reform in terms of cost control. It is because we believe in this Commonwealth that health is a public good, and that everyone deserves access to high-quality, affordable care. And I thank you all for being a part of today's milestone, a further step on that journey. Thank you so much.
Well, the first thing we're going to do here is search a recipient, and the recipient will be Baystate. Next, we will select the patient.
Any volunteers?
I think we know the patient.
It's asking for security confirmation that you really want to send the governor's friend.
So at this point, we will generate and gather the information. The governor, I'd just like you to have a look at this to confirm that this is you and this is your pertinent information.
Yeah, that's me.
Now, Governor, what we would like you to do is push the button. So right there, that mouse click, with the mouse click.
Count of three.
1, 2, 3. Okay. Clinical document successfully sent.
All right.
Okay. Let me tell you what is happening over the internet. As you mentioned, security is very key. It is taking the digital credentials from Massachusetts General Hospital, and it is wrapping that message in their digital credentials, so we know it came from Dr. Rubash at Mass General Hospital. It is sent using the digital credentials of Baystate. No one in between Mass General and Baystate could interpret or decrypt that message. We guarantee it gets to Baystate. We guarantee it was authentic from the Mass General and not in any way modified along that path. It's fully audited, and of course we did it with your consent and agreement, because the patients will always be driving this process. What is important is it's left one siloed information system, the Partners Healthcare Systems LMR, and it is arriving in a vendor system, the Cerner medical record. Totally different organizations, totally different parts of the state, and totally different electronic systems using standards over the wire. Okay, and so we are now turning it back to our friends at Baystate. I see here Deval Patrick's record sent to Baystate.
Governor Patrick, we have received your medical record. It is now on.
giving notice at 11:36 a.m. on the 16th, either day, your record was received into the server system. The continuity of care summary includes your entire medical record, the problems, the medications, the allergies, everything that's necessary